As with physical abuse, there are both physical and psychological indicators a child care provider might observe in a child who has been sexually abused. In the case of sexual abuse, however, some physical signs may go unnoticed, especially in typically developing children who are school age and older, because caregivers do not generally need to help these children with diapering or using the bathroom. If a caregiver does need to help a child who is a victim of sexual abuse with diapering or toileting, though, she may notice the following signs: torn, stained, or bloody undergarments, bruising, bleeding, redness, swelling, or itching of the genitals or anus, indicators of pain when walking, running, or sitting, frequent urinary tract infections or problems when urinating, frequent yeast infections, unexplained gagging, and pregnancy or sexually transmitted infection, especially in a child under 14 years old. Children who are sexually abused may also report pain when sitting or walking, or may specifically complain of pain or itching in their genital areas. More common than physical indicators, child care providers may notice psychological markers that raise suspicions that a child may be a victim of sexual abuse. Some psychological or behavioral signs indicating a child might be a victim of sexual abuse include developmental regression, such as bedwetting in a child who has previously been fully potty trained, dramatic changes in eating habits or appetite, withdrawing behavior, acting out behavior including aggression, declining academic performance, fearful behavior, unusually excessive crying, clinginess, avoiding physical contact or affection, especially with a particular adult, dramatic fear of either men or women, unexplained complaints of aches or pains, extreme mood swings, lethargy, and a seeming lack of interest in play, sudden avoidance of physical activity, unusually secretive behavior, fear of a particular place, person, or situation, preoccupation with sexual behavior, vocabulary, or body parts, such as a young child touching other people's genitals or breasts, or acting out sexual behavior with dolls, hypersexualization, including trying to get other children to perform sexual acts, depression, possibly even suicidal behavior, self-mutilation, nightmares or trouble sleeping, unusual drawings, such as drawing children without hands or mouths, or drawing images of genitalia or sexual acts, fear or resistance during rest times in childcare, difficulty forming or maintaining relationships, drug or alcohol abuse, and sexual promiscuity. Individuals who perpetrate child sexual abuse might be unusually protective of the child, keeping her away from other children, especially children of the opposite sex whenever possible, may appear jealous, be overly controlling of the child, or appear isolated and secretive. Any of these signs could indicate a child is a victim of sexual abuse, and though the presence of these signs can also indicate other problems or no problem at all, a child care provider who sees any of these signs may have reason to suspect abuse. Of course, if a child reports having been sexually abused, the child care provider should consider it grounds to report, even if no other signs are present. In cases of emotional abuse, also called psychological abuse or verbal abuse, children will not usually show physical signs because the injuries caused by this type of abuse affect the child's emotional well-being. Children who suffer emotional abuse may show psychological or behavioral signs such as eating disorders, ulcers, trouble making friends, withdrawing behavior, including avoiding participation in activities with other children, frequently having blank facial expressions, avoiding giving and receiving affection, fear of a particular parent or caregiver, acting out behavior such as aggression or tantrums, oppositional or defiant behavior, overly compliant or passive behavior, dramatic shifts in behavior or moods, academic or learning problems, developmental delays such as lags in physical development or speech delays, hyperactivity, fearful behavior, bedwetting or soiling in a child who has been potty trained, sleeping problems including nightmares, facial tics, rocking motions, and other stress responses such as thumb sucking or biting, being a caregiver or parental figure to other children, clinginess or extreme dependence on adults, self-mutilation such as cutting or self-injury behaviors like headbanging, depression including excessive crying or even suicidal behavior, low self-esteem including frequently saying "I can't," running away from home, poor motivation, and drug or alcohol abuse. Adults who perpetrate emotional abuse might reject, blame, belittle, or berate the child, call the child insulting or disrespectful names, compare the child to siblings in a negative way, or give siblings drastically unequal treatment, appear not to care about the child's feelings, and refuse offers of help for the child's problems. Children who show one or more of these signs may be victims of emotional abuse. These signs could also indicate other problems, but child care providers who observe them should consider they may indicate emotional abuse. Also, children who are victims of emotional abuse are often also victims of other forms of abuse, such as physical or sexual abuse, and the signs may overlap.